Chasson's mentioned it. If you haven't watched that oral history of substance use research project by Nancy Campbell out of RPI, you really should watch it. It is incredibly, and it's an interview of Herman is what I'm talking about. It's about 150-page transcript. But it really gives the moment when this field was born in New York. And Herman was there. If you think about Herman's career, Herman had a remarkable career, mostly unnoticed by his colleagues, mostly unnoticed by his agency. Just to think that when Vincent Dole and Maria Neiswander was doing the research on methadone as a medication for opioid addiction, Herman wasn't working there. Herman was a probation officer. So now so these giants in our field, if you speak to anyone about what happened, because there were also giants on the drug-free side, it was when the whole field was born in the mid-60s, all of this activity going on, and in the middle of it is this probation officer from New York City. How did that happen? And to me, it so much describes Herman and his remarkable career. He just didn't take boundaries. He just didn't recognize them. So he saw on his patient load, he started keeping statistics on relapse and deaths among his heroin-addicted probationers. And he said, this is ridiculous. In fact, in the Nancy Campbell, they talk about him confronting Ephraim Ramirez, the founder of Phoenix House and the head of the New York City Addiction Services Agency, who was talking about therapy communities, and he said, well, but the relapse rate is so great. So he was kind of a contrarian, Herman, as well, but he had this data, and he just couldn't, he wouldn't violate his probationers, and he found out about what Dole and Neiswander was doing, and he showed up. He went to their lab, and he started to figure out, now, he's not working for them. Somehow, his work in probation, for the probationers allowed him, and he kind of gives them a little credit for it too, of working with a scientist, a giant of a scientist, on heroin addiction to help his probation clients. Herman didn't join Rockefeller until 1974. He was working with Dole for 10 years. He was writing articles with Dole, and he wasn't on staff there. That really, to me, captured so much of what Herman Joseph is about. And he says it actually in this Nancy Campbell interview. He says when he was working for the Oasis, starting in the 80s, maybe in the 70s, he said, you know, they didn't know what the hell to do with me, so I just continued to do what I wanted. And that is Herman. But what he did was incredible. It was remarkable, the amount of groundbreaking work that this man did. And it was even news to me as I looked at it, because I never really reflected on it. Just look at opioid treatment modalities. Key. Herman was involved in the first methadone treatment program within prison at Rikers Island. Him, and of course he gives credit to Frank Tadallo and John Perez and others from Oasis who helped it, but Herman was in on that. Medical maintenance. Herman talks about how Dole talked about medical maintenance, but how the need for integration of primary care within treating methadone was an important modality. So it wasn't just medical maintenance, doing away with the strict regulations. It was building in the need to treat the whole patient. And of course, in this work today, that's exactly what they're talking about. That's exactly what buprenorphine is based on, office-based medication-assisted treatment. How many conversations did I have with Herman about programs that were low-dose methadone and how that wasn't holding patients? He was that level, the level of intellectual heft and scientific basis, scientific knowledge that he brought to this field was incredible. And so he worked to help programs recognize that if you didn't dose people appropriately, they were going to relapse. Herman had the mind of a scientist, but he had the heart of an activist. And that's a very rare combination, extremely rare combination in a bureaucracy. But he somehow found a way to do this. And I was privileged to work with him on some of it in terms of the HIV work, the HCV work. When the HIV epidemic hit, I was the staff person doing it for the Substance Abuse Agency. Herman quickly recognized the need for a needle exchange, that you can't have injectors being exposed to a deadly virus. There was no treatment at the time without safe syringes. But he'd also say, but that's not going to work for cocaine injectors because they inject so much. So he was already thinking about how you had to have safe access, that needle exchange where you bring in 10 and you get 10 wasn't the answer. He was always that kind of forward-looking individual. He developed a cocaine research group in the crack epidemics of the 80s. When he did that, it wasn't just epidemiology. He brought in ethnography. He brought in people working on medications. He was a collaborator. He brought people together. So HIV, no one knew about hepatitis C. And so he comes to me and says, and Herman Joseph must have said this phrase to me 1,000 times. Frank, we've got to do something. That was his approach. We can't be still. And what he'd often do is organize a conference, write a paper, write a book, bring the best minds together to address the problem. That was Herman's knowledge is power response. We put on the first HIV hepatitis C conference, I don't know if in the country, but certainly in New York. It was done with Cy's help at Mount Sinai. Audience was packed. He had the best folks on HIV, HCV presenting, all the docs. So afterward, you wouldn't believe the number of people at Oasis that came up to me who were who had used heroin addicts. They somehow had missed the HIV epidemic, who found out that they were HCV infected and went for treatment. And they thanked me when they should have been thanking Herman, because it wouldn't have happened, except that Herman, as Mark said, Herman said, we've got to do something, we've got to do something. That was Herman Joseph, this remarkable career in the midst of this bureaucracy, in the midst of this, everyone having their standard roles and everyone has something to do. He just created this space to be able to address significant issues at the time in terms of opioid addiction. I would be remiss if I didn't mention his work on stigma. And what's interesting, if you look at the Nancy Campbell interview, he talks about stigma as his learning about his disability. And he won't use the word disability. He says, well, I had a physical impairment. He had Erb's palsy. He was paralyzed on his right arm. He was blind in one eye. And he said, because as a teenager in particular, when he realized his disfigurement, as he used the word, made him feel shameful, made him feel stigmatized, and that he thinks he's to probation and to his work at Oasis, and finally to his work with NAMA and Stop Stigma Now, he says that goes back to that kind of fundamental experience of knowing what it's like to be shamed. His work, he was so patient-centered. Of course, you'd never know it. He doesn't speak about patients in that kind of, like, oh, the poor patients. But that's exactly what he was. He saw stigma as fundamental to the problem of substance use in this country, and that we have to address it forthrightly, directly, and to start to move past the kinds of shaming and rules that seem to interfere with the care of treatment. I got to know Herman. We have a seminar at Columbia. You're all invited, by the way. Every third Tuesday, Sharon has presented there. Janie, I'm going to get to present there. Andrew's presented there. Tuesday, every third Tuesday, we have and Joyce has presented there too. We get together for dinner and we get together for a seminar. And so there's about 15 people who come to, it's right here in this building. But there's about 80 people who belong to the seminar. So I'd say, okay.